Now, let's talk about our fifth biomarker, which is prognosis biomarker. But for me, when first went through these biomarkers, on the surface, prognosis biomarker and predictive biomarker sound somehow the same to me, but I wanted to understand the difference. Hence, let's clarify the difference between prognosis biomarker and predictive biomarkers. Both are essential for personalized medicine, but they serve a different purpose. Prognosis biomarkers provide information about likely course of disease, including its potential to progress, reoccur, or lead to a specific health outcomes. For example, in people with active IBD, a blood-based biomarkers can indicate whether the disease might become more aggressive and if prompt treatment escalation is needed. Whereas predictive biomarkers indicate how likely you are to respond to a specific treatment. They help in selecting the most effective therapy for your condition. For instance, certain genetic mutations can predict whether a patient will respond well to a particular cancer drug. We talk about that in our fourth biomarker. So, in summary, prognosis biomarkers help forecast the disease's trajectory, while predictive biomarkers help forecast the effectiveness of a particular treatment. Now, after understanding these differences, let's talk deeper about prognosis biomarkers. So, prognosis biomarkers offer valuable insights into the future progression of a diagnosed condition. By understanding these biomarkers, healthcare providers can predict the course of a disease, identify at risk for severe outcomes, and tailor treatments to manage the conditions more effectively. It's important to note that, however, some prognostic biomarkers may not be definitive, and a combination of factors is often used for risk assessment. Obviously, for this reason, consulting a healthcare provider for professional and personalized interpretation is crucial. So let's talk one by one and talk about some examples. For example, prognosis biomarkers for inflammatory bowel disease. For people with active inflammatory bowel disease, prognosis biomarkers can indicate whether the disease might become more aggressive if a prompt treatment escalation is needed. And for that, four biomarkers are measured: one, C reactive protein; two, fecal calprotectin; three, serum albumin; four, genetic markers, NOT2 mutations. All of these things we talked about earlier as well. So, elevated CRP, fecal calprotectin may indicate the progression, and the low levels of serum albumin indicates poor nutrition status and chronic inflammation, which are associated with worse outcomes in IBD. And obviously, genetic mutations like those in NOT2 gene can indicate high risk for severe disease. And obviously, we don't want the presence of elevated CRP and fecal calprotectin levels. We don't want low serum albumin, and we don't want the positive genetic markers. We want low normal levels of CRP, calprotectin, and normal levels of serum albumin, and absence of genetic mutations. Also, let's talk a bit about the prognosis biomarkers for cancer. Again, the four biomarkers measured are carcinoembryonic antigen CEA, cancer antigen 19-9 CA 19-9, KRAS mutations, and microsatellite instability MSI. So CA and CA19 as we talked about earlier, measured through blood test, and KRAS mutation and MSI is measured through genetic testing for tumor tissue obtained via biopsy. And obviously, we don't want the elevated levels of it. So present elevated levels of CA and CA19-9. We don't want KRAS mutations. So we don't want the presence of these mutations, which indicates, which generally associated with poorer prognosis and resistance to certain therapies. And MSI, high levels of MSI are associated with better prognosis and response to certain immunotherapies. Again, for positive signals are identifying elevated CA and CA-19 levels, KRAS mutations, and MSI status can help tailor treatment plans and surveillance strategies to improve outcomes. And what we want is negative signals are normal levels of these biomarkers and absence of high risk genetic markers suggest a better prognosis and lower risk of occurrence. So let's also talk about prognostic biomarkers for chronic liver disease. So, in chronic liver diseases, prognostic biomarkers can predict disease progression and the likely of complications such as liver cirrhosis or liver cancer. And four biomarkers measured are alpha fetoprotein (AFP), bilirubin, aspartate aminotransferase (AST), and alanine aminotransferase (ALT), and four platelet counts. So AFP, bilirubin, AST, and ALT are measured through blood test, and platelet counts, the part of complete blood count CBC test, where a blood sample is drawn to measure the normal platelets. In short, all these four are measured through blood test. And what does value and their meanings? So AFP, elevated levels can indicate the absence of liver cancer. Sorry, elevated levels can indicate the presence of liver cancer. Bilirubin, high levels suggest the liver dysfunction and can predict disease progression. And AST and ALT, elevated levels indicated liver inflammation and damage. And platelet count, low levels can indicate advanced liver disease and portal hypertension. So monitoring these biomarkers help predict the risks of liver cancer, cirrhosis, and other complications, guiding proper, appropriate interventions and monitoring. And normal levels of these biomarkers indicate stable liver function and a lower risk of complications. Hence, prognosis biomarkers provide critical insights into future course of disease. By understanding these biomarkers, healthcare providers can tailor treatment plans to manage conditions more effectively and improve long-term outcomes.